Polycythemia vera, or PV, is what the topic is for this video. And polycythemia vera is what you call a myeloproliferative disorder. And what this is really referring to is the proliferation of blood cell lines. So which blood cells are we talking about? We're talking about red blood cells, white blood cells, and platelets. And these are the three lines of blood cells that are increased in number in PV, polycythemia vera. Just really quick before we get into all the symptoms, happens more commonly in men. The mean age is about 60, and most of the questions on the licensing exams are actually talking about what happens because of the increased red blood cells. So I wanted to quickly touch on those things. So what are some of the symptoms? Well, interestingly, for the most part, there really are no symptoms. A lot of them are asymptomatic cases, but if there are symptoms, the most common one on a clinical vignette will be itching or pruritus after a hot shower or bath. And that's a very key one. There's other ones that are also very important, like splenomegaly, enlargement of the spleen that you can palpate. That's also very common on presentations. There's some non-specific symptoms as well, but these are the two big ones. Now, why is this important if we're still talking about symptomatology? Why is polycythemia vera important? The reason is because when you have an increased red blood cell mass, what that means is you have an increased hematocrit. And hematocrit, as many of you know, is the percentage of blood that's red blood cells. And this can lead to something known as hyperviscosity. And hyperviscosity is essentially making the patient prone to blood clots or thrombosis. So that's really the reason why polycythemia vera can become a problem. And the thrombosis can have some pretty devastating effects. It can cause a lot of significant problems, which include stroke, CVA, also known as CVA. It can cause a transient ischemic attack. It can cause a deep venous thrombosis, DVT, and then it can also cause a heart attack, a myocardial infarction. So these are very important to remember as the possible outcome of having polycythemia vera and having an increased red blood cell count and an increased hematocrit, basically. So how do you diagnose this? Well, of course, the complete blood count is going to be your main test, and this is a relatively inexpensive test. And what you're looking at are the hemoglobin and the hematocrit. I can write it out. Hemoglobin level and the hematocrit. For a man, the hemoglobin, if it's greater than 18.5, or for a woman, greater than 16.5. For hematocrit, for a man, greater than 45, and probably greater than 42 for a woman. These are very high values, and this will definitely lead to a diagnosis of polycythemia. Other tests that are important that can lead to this diagnosis is something known as an erythropoietin level. Erythropoietin is a precursor to red blood cell production. Now, in polycythemia vera, this actually, because of negative feedback, the erythropoietin levels will actually be low. because you have such high red blood cell counts that there's a process of negative feedback that occurs that makes these erythropoietin counts low. So that's a classic scenario on the lab tests to point to this. So how do you treat it? There's three main things. The first thing is you give aspirin, actually, and that is to reduce the incidence of the thrombosis or thrombotic complications. Because we all know aspirin helps prevent blood clots. The next part is you do a phlebotomy. Phlebotomy essentially is just removing blood from the body with the goal of getting the hematocrit down. And the final one is giving myelosuppressive drugs. Now remember, this was a myeloproliferative disorder, so you give a myelosuppressive drug, and the most common drug is hydroxyurea. So those are the three fundamental aspects of treatment of polycythemia vera. So let's take a look at some clinical vignettes. 55-year-old white male comes to your office with weakness and headache. He has also described annoying pruritus that occurs frequently after he takes a hot shower. Physical exam is remarkable for the presence of an enlarged spleen, splenomegaly. He has a hemoglobin level of 21, hematocrit of 63. To confirm your clinical diagnosis, you obtain additional studies. Which of the following would be most consistent with the most likely diagnosis? Well, this clinical vignette, he's got the classic pruritus after a hot shower. He's got the splenomegaly, very high hemoglobin, 21, 63 for hematocrit, and the normal values are given there. So he definitely has polycythemia vera. Now, remember I had talked about how erythropoietin, also abbreviated EPO, because of the increased RBC levels, there will be a negative feedback mechanism that goes back and tells the body to not produce erythropoietin in normal levels anymore. So the erythropoietin level will be low, and the answer therefore is A. Last one, a 30-year-old man comes to the office with increasing lethargy and fatigue over the past year. Generally healthy, no significant past medical history, denies any shortness of breath, weight loss, or feelings of sadness or depression. He continues to be very active, exercises 4 to 5 times a week. Full neurologic and physical exam is unremarkable. There's no clubbing or cyanosis. 12-lead EKG and chest radiograph appear normal. Blood work is remarkable for a hematocrit of 59. And you call him to tell the results. He should be told that he is high risk for. Well, a very high hematocrit basically is what it does is it makes the blood more viscous. So the viscosity increases, also known as hyperviscosity. And hyperviscosity can lead to thrombosis, blood clots. And thrombosis can further can cause quite a few things. They can cause a DVT, they can cause a stroke, also known as CVA, they can cause a mini stroke, also known as a transient ischemic attack, and they can also cause a heart attack, known as myocardial infarction. So let's see if one of these is the right choice. Stroke right here. So the answer is E. Stroke is also known as a CVA, cerebrovascular accident.